is recognized.
Thank you, Mr. President. The COVID-19 pandemic continues to take a tremendous toll on our nation. Healthcare workers have valiantly served our community throughout the crisis. Still, we face unprecedented challenges, and this moment calls for historic action. The pandemic laid bare the gaps in our healthcare system and magnified long-standing inequities. Health inequities have been eating away at our community for many years, which is why I have fought for policies to reduce economic and social inequalities overall, ensure access to nutrition, education, and housing, and increase funding for social and mental health services. Earlier this year, Congress enacted some of those reforms in the American Rescue Plan Act, which is bringing much-needed help to Marylanders and Americans across the country. It was a strong investment to complement ongoing efforts to curtail the rapid spread of the virus, particularly as we grapple with more contagious variants such as the Delta variant. Now we have the opportunity to enhance that effort through the Build Back Better Act. Even with the significant investments in health care over the last year and a half, Americans are struggling to pay for their basic health care needs, like prescription medications and mental health care. Waiting lists for home and community-based services so individuals can age in place with dignity are in the thousands or tens of thousands in states around the country. In my state of Maryland, over 30,000 seniors and individuals are waiting to get access to home and community-based services. Now we have the opportunity to make prescription drugs more affordable, expand access to home and community-based services, extend enhanced financial support to individuals in the individual market, and permanently fund the Children's Health Insurance Program, the CHIP program. We have been working on these problems for years, and in some cases for over a decade. Congress is long overdue in acting to remedy them. As we make these historic investments, we must also redouble our efforts to address the long-standing gaps in healthcare access. For instance, we have a once-in-a-generation opportunity to make major reforms in Medicare benefit. Earlier this year, I reintroduced the Medicare Dental Benefit Act, which would add dental benefits to Medicare. It would help more than 56 million seniors and people with disabilities afford much-needed dental care. According to the Wisdom Tooth Project of Oral Health America, nearly 70% of seniors lack or have limited access to dental insurance, and fewer than half have access to dental care each year. Those numbers are inexcusable. We should be working to strengthen and expand access to quality, affordable dental care for all Americans, regardless of age or income. That is why today I am introducing, along with Senator Stabenow, the Medicaid Dental Benefit Act, which would extend comprehensive dental health benefits to tens of millions of low-income Americans. Currently, states have flexibility to determine whether to provide dental benefits to adult Medicaid enrollees. Although most states, including my state, provide at least emergency dental services for adults, fewer than half the states provide comprehensive dental care. The consequences of such haphazard access could not be clearer. Higher costs and worse outcomes. A recent report by the Agency for Healthcare Research and Quality found that Black, Hispanic, and low-income adults visited the emergency room for dental care at the highest rates of any group in 2018. Many of you have heard me speak before of the tragic loss of DeMonte Driver, a 12-year-old Prince George's County resident, in 2007. DeMonte's death was particularly heartbreaking because it was entirely preventable. What started out as a toothache turned into a severe brain infection that could have been prevented by an $80 extraction. After multiple surgeries and a lengthy hospital stay, DeMonte passed away nearly 15 years ago, just a few miles from this building. It is imperative that we use this once-in-a-generation opportunity to increase access to dental care, which will improve the overall health of millions. To echo former U.S. Surgeon General C. Everett Koop, there is no health without oral health. Adequate access to oral health is essential to preventing tragedies like the DeMonte Driver death from ever happening again. Let us continue to build upon the progress made to date in advancing the access to oral health to protect individuals around the country. As we work to pass this legislation, let us not lose sight of what is at stake. Just in the last few days, we have seen some of the best that American healthcare can provide, but also some of the worst. Vaccines are making a critical difference in the fight against COVID-19, and just this Wednesday, they will be available to all ages 5 and older. It is a momentous achievement and a great achievement to families and communities around the nation. At the same time, women in Texas are being denied access to reproductive health care, while on Monday, the Supreme Court heard elements in 2 cases challenging the Texas anti-abortion law, SB 8. Roe v. Wade has been the established legal precedent in this country for more than a half a century. But anti-choice activists continue to push and adopt policies like SB 8 that are sending this country and women's health and well-being in the wrong direction. Women and their health care should not be under constant threat. If we fail the women of America, we fail our nation. Right now, we have a choice on how we as a nation want to emerge from the pandemic. We can continue on the same course, leaving millions of families behind, or we can answer the call of the American people and invest in high-quality, equitable health care. Let us answer the call. Mr. President, I would suggest the absence of a quorum.
The clerk will call the roll.
Ms. Baldwin.